Hello everyone. Today I am going to talk about chronic obstructive pulmonary disease, commonly known as COPD. COPD is a chronic lung disease that makes it difficult for a person to breathe and requires long-term management. First, let's understand the difference between acute and chronic disease. An acute disease has a sudden onset, lasts for a short time, and is usually curable. In contrast, a chronic disease develops slowly, lasts for a long time, often lifelong, and requires continuous management. COPD is a chronic condition. COPD mainly includes two conditions, emphysema and bronchitis. In emphysema, there is damage to the air sacs in the lungs. In chronic bronchitis, there is inflammation and mucus production in the airways. Here, I would like to talk about palliative care because it's really important to manage COPD. Because COPD is not curable, we manage it with long-term management with nursing care and medical treatment. What is palliative care? Palliative care is a type of care focused on comfort, symptom relief, and quality of life for patients with chronic or serious illness, rather than on curing the disease. Now let's understand how COPD develops. Due to smoking or exposure to irritants, the airway becomes inflamed and narrowed. Excessive mucus is produced. Air gets trapped inside the lungs. Gas exchanges becomes difficult. This leads to the shortness of breath and decreased oxygen levels. There are two commonly used terms. Blue bloater refers to chronic bronchitis patients. Pink puffer refers to emphysema patients. Let's talk about causes and risk factors. The number one is smoking, secondhand smoke, air pollution, occupational dust chemicals, recurrent respiratory infections, genetic factors, alpha-1 antitrypsin deficiencies. Common symptoms of COPD include shortness of breath, chronic cough, extra mucus production, fatigue, increased chest diameter, that is also known as barrel chest. But there is also another sign and symptoms that are dyspnea, cyanosis in severe cases, fatigue due to use of excessive muscles, crackles due to the chronic mucus, weight loss due to extra efforts to breathe in and breathe out for proper gas exchange. Other signs and symptoms are lower ABG, PA2 decreased, that causes hypoxemia, wheezing sounds that are due to bronchitis, hyperinflated lungs due to lack of pressure maintenance, clubbing we see sometimes in patient fingers, barrel chest. I'm going to show you in next slide. Here in the picture, you can see the normal chest, and the second one you can see the barrel chest, where increased anterior posterior chest diameter. That becomes barrel chest. That is very common in COPD patients. The main diagnostic test for COPD is spirometry, which measures lung function. I will show you in my next slide. The other tests that are done to check whether it's COPD is pulmonary function test, chest X-ray, chest CT scan in some patients we do, ABG always, sputum culture if infection suspected. So here you can see patient having clip on the nose and blowing in the tube. In this test, patient takes a deep breath and blows as hard as possible into the tube. We can take the reading from the monitor, then we can decide whether it's COPD or it's not COPD. Alrighty. If not managed properly, COPD can lead to complications like respiratory failure, pneumonia, and heart problems. So, very important task is nursing diagnosis. The first one is ineffective airway clearance. That is due to excessive sputum production. Second one is impaired gas exchange, definitely because of emphysema. Another one is activity intolerance due to difficulty breathing. Next one is imbalanced nutrition due to loss of appetite. Next one is anxiety related to breathing difficulties. As nurses, our management includes monitoring ABG for respiratory acidosis, maintaining oxygen saturation between 88 to 92%, administering oxygen therapy as prescribed by doctor, providing chest physiotherapy, encouraging steam inhalation that helps to loosen the mucus, monitoring the vital signs that are very important. We also position patient in high Fowler's position and encourage pursed lip breathing, promote coughing and deep breathing, monitor sputum, encourage smoking cessation. We can say encourage the patient to stop smoke, promote rest and energy reservation. Diet always play an important role in COPD management. We focus on high calorie diet, moderate carbohydrates because patients lose weight and loss of appetite due to difficulty breathing. We don't give them fats that takes time to digest and displace the diaphragm and that cause the difficulty in breathing. Next one, high protein. That helps to maintain the weight, and high vitamin diet that helps to maintain their health, right? Next one is we need to increase the fluid intake to help the mucus to loosen. Common medications that are used for COPD are antibiotics for any active infection, corticosteroids to reduce inflammation, mucolytics to lose the mucus, bronchodilators to open the airway. That makes the life easy. Important nursing education to COPD patient. First one is COPD diet that we discussed earlier. They need high calorie, high protein, frequent small meals, and moderate carbohydrate and balanced diet. They can use satin bed sheets and satin pillow covers. Using wet mop and wet dusting prevents them from any dust. Also, they should stay away from pets if they are allergic to them because their dander can be allergic. Always avoid smoke at home. To conclude, COPD is a chronic progressive disease that cannot be cured, but with proper treatment, lifestyle changes, and nursing care, we can improve the patient's quality of life.